This is Lauren Dunlap, Executive Director for Advocacy and Awareness for Immune Disorders Association, or AAIDA, in Charlotte, North Carolina, and I'm happy to host this afternoon's educational webinar. AAIDA's mission is to provide support and advocate for the greater than 25 million Americans living with immune disorders. AAIDA works to promote research and create better awareness for immune conditions. This is AAIDA's fifth webinar for 2022, and today I will be joined by cybersecurity expert Igor Pinchevskiy as he discusses keeping you safe, cybersecurity and your protected health information, or PHI. Igor Pinchevskiy began his career in information technology in 1999 after graduating with a degree in network engineering. Igor specializes in IT managed services, security assessments, vulnerability testing, and industry-specific cybersecurity and compliance standards. This includes HIPAA, or Health Information Portability Act and Protection. Sorry, I just totally butchered that. HIPAA. NIST framework, PCI DSS, and P2. Igor runs an IT service and cybersecurity consulting firm specializing in helping nonprofits and businesses. Igor builds, maintains, and secures organizations' IT's environments by helping them to meet industry security requirements. Igor, thank you so much for volunteering your time this afternoon and letting us learn about cybersecurity. We're excited to have you.
Thank you, Lauren. Excited to be here. I'll try my best to scare everyone.
And I'm sorry, Accountability Act. I was trying to get HIPAA, out of my mouth. It's a mouthful. Health Information Portability Accountability Act. Cha, got it.
Well, you got it. Perfect. Awesome. Well, thank you again. I'm excited to be here. Hopefully, I can teach our audience a few things to be on the lookout for these days.
All right.
All right. So with that, let's get started. We're going to talk about healthcare scams and what you can do to avoid becoming a victim. Before we get started, I know Lauren quickly touched a little bit about the housekeeping rules. I just want to go over a couple of things. You should see on your screen a little toolbar with an orange arrow. If you can click on that orange arrow, you should see a little menu that's going to open up a little window. If you guys can hear me, if you can just type in "I can hear you" into the question box, that would help us out to make sure we are good on the audio side.
I think everybody.
Okay, and Laura, let me know if anybody's have any issues or questions.
I don't see anything right now.
Okay. All right, so
they can put that in the chat or the questions
in the chat. Yeah, chat will work.
Yeah.
And the next thing, if you can see this little kitten, if you can type in "I can see you" in the question box or the chat, that would be great as well. You might also want to grab something to write with, just to save some tips and take quick notes. And with that, I'll get started with who the heck is Igor Pinchevskiy. Well, I've been in this business for about 20 years. We've been doing cybersecurity and managed services and tech support for clients of all sizes. As you can see on the screen, some of these are global companies that we worked with. I wanted to share a little bit about my family so you guys get to know me, maybe make a little connection. Top left, my wife, Leanna, and my daughter, Brianna. Top middle is me holding an Oscar. Unfortunately, I did not win, but that is an actual Oscar from one of our clients. That was I was honored to hold it, and just tried one of those fake Oscar acceptance speeches, just because it seemed like the right thing to do with an Oscar. Top right, my daughter Brianna, training for a boxing match. Bottom right, entire family in the picture, my son, my daughter, my wife at the birthday party, if I remember correctly. I run multiple companies. One of the challenges is finding financial officers. We had to hire 2 CFOs. Unfortunately, my CFOs did not like finances much, so we had to change them into our chief fund officers, and they are Duke and Lola. They help run my companies. And then obviously being in cybersecurity, we needed to hire a CSO. Unfortunately, our CSO was not that good at security, but was great at sleeping. So we named him a chief sleeping officer as Lionheart, as you can see. And that makes up our executive team. So a little bit about me and why am I so passionate about security. Working in cybersecurity field, unfortunately, I get to see a lot of bad things happen to people and businesses and organizations beyond belief. And I'm trying to help as many as I can, trying to avoid all those scammers and hackers from taking advantage of innocent people and businesses that are just working hard trying to protect what they have earned. As a kid, I think as all kids, we always dream of being superheroes. And I'm happy to say that I act, my current job is kind of a cyber hero, or I'm sorry, a superhero slash cyber hero, helping people and businesses to avoid being scammed and hacked by the bad, so many bad people out there that are trying to get you. My personal mission is to help protect over 1 million people by the end of 2025. We started this about a year ago. Great progress, and hopefully, we can spread the awareness and help as many people as we can. So what we're going to be going over today are a couple of things. The first one is medical identity theft. That's a big issue that's happening in today. The other thing we're going to look at, exploiting our COVID crisis. Now I know kind of everything has cooled down with COVID a little bit, but it doesn't mean the next whatever that's going to be is not going to be using the same tactics to basically scam and hack people.
Maybe monkeypox next, Igor. I don't know.
I was going to mention monkeypox, but it sounds like it's not gaining the traction that COVID and Corona had with us. And the next thing, we're just going to go over a couple of best practices for keeping your PHI and other sensitive information secure. And if you have any questions, please feel free to put them into the questions box, and we'll get to them as they come in. So let's start with medical identity theft. First thing, what is medical identity theft? Because most of the time when we hear about identity theft, we always automatically assume it's financial, right? Somebody stole my identity and opened a bunch of credit cards, got a loan, bought a new house, got married, things like that. But in fact, medical identity theft makes up a huge percentage of all the scams and hacks that are going on. So medical identity theft is a form of identity theft that occurs when someone fraudulently uses your health insurance information to gain illegal access to medical care services. These services may include drug prescriptions, doctor appointments, treatments, surgeries, even health equipment. Criminals may also submit fraudulent information to health insurance companies to receive payouts, which we see quite frequently. In fact, there was a case recently where a woman, a mother of 4 kids, was prosecuted for giving birth to a meth-addicted child. And what happened was there was a meth addict that broke into her car, stole her driver license. With her driver license, went to a hospital to give birth to a baby, which got taken away by child services. Then she also applied for other medical assistance and things like that. Needless to say, it took months and months and thousands of dollars to clear the name. So it's a very serious threat to anybody. How does medical identity theft occur? Couple of different ways, right? So to carry out any kind of, or at least the medical, scams or hacks, as we call them, the hackers or scammers, they need to get some of your personal information, right? Some of that personal information is getting full name, date of birth, your contact information, such as your address, your phone numbers, social security numbers, possibly medical records, financial records, driver license. All of those are considered your personal identifiable information. When the hackers or scammers can get their hands on one or two or more of these, now they have enough information to do some damage to your identity. So perhaps you were part or had your identity, medical identity, stolen, and you didn't even know, right? You possibly were billed for a prescription that wasn't yours, right? Sometimes it could be by mistake, or sometimes it could be intentional. Same thing, maybe there was a medical procedure that you did not request, or maybe you received a misdiagnosis for a surgery you didn't have. All of those things occur regularly. Sorry about that. I'm not sure what happened with my mouse. And a lot of times we just assume a mistake was made. And you would never think that this possibly was medical identity theft. And medical identity theft is so pervasive that most victims don't even see it coming, because a lot of us don't look at those details. Usually once you get your medical bill, it has so many different items, we don't tend to look at it because it's all a different language to us, and we just don't want to look at it. So it's imperative that you guys check line item by line item. And then you have those medical statements or bills that you get to make sure that those in fact are the actual procedures or prescriptions or any kind of medical treatments or equipment that was done for you. So there's different types of medical identity theft. There's friendly fraud. What is friendly fraud? This is when you give your medical insurance, Medicare, health insurance to use for a friend or a family member. One of the reports, as you can see, 23% of medical identity theft victims admitted giving their family members or close friends consent to use their health credentials. I've had a friend who was, unfortunately got their health insurance card stolen by one of their family members because they couldn't afford their health insurance with prices that are going on. And that turned into a whole fraudulent legal battle and issue. So you want to make sure that you keep all of your medical information secured, right? Don't leave it lying out because even it doesn't have to be stolen basically for it to be used and abused by others. Then there's the outsider fraud, right? This is when somebody you don't know, like a hacker or a scammer, tries to get your information, medical information, and use it on your behalf for various things. As you can see on the slide that's on the screen, right? One of the biggest breaches in 2021, a company, 3.5 million patient records were stolen, right? So once the hackers steal those records, what they do is they put it on the dark web where they sell it for a lot of money. At that point, the other hackers or scammers, they purchase those records, and then they try to illegally obtain either medical treatment. Prescriptions is probably the biggest one. What they use it for, they'll get prescription, for expensive medications that will, at that point, they will try to resell. And then there's the inside fraud, which is another big one, right? Unfortunately, not all healthcare providers or employees are as honest as others. And in 2019, scammers submitted over 1.7 billion in Medicare claims that were all fraudulent, right? There's different ways that insider fraud occurs. A lot of times, especially with Medicare or Medicaid, the free insurance, right? The providers would prescribe all sorts of medicine, equipment, and things like that, obviously not giving it to the patient. They would keep the profits, and the patient would receive some kind of a gift, right? It could be a monetary gift, it could be a vacation on a cruise or something like that. I see those types of fraud very frequently. Unfortunately, us are the ones that end up paying for it with insurance costs going up, Medicare costs going up, everything is going up, and a lot of it have to do with the fraud.
Well,
That
I will say a lot of that has with the kickbacks with the Sunshine Act, that has calmed down a little bit with CMS implementing the Sunshine Act. So it's not as bad as it used to be in regards to the kickbacks from companies, from big manufacturer companies to the providers. I will say that one point, and that's and you can actually go online and see, you can look up your provider if you think there's something weird there.
Yeah, so I believe the kickbacks that you're referring to is for a provider to prescribe, right, a certain type of a medication over another just because they're getting a bigger kickback from those companies. Is that what you're referring to?
Yeah, but they could, like what you're talking about in here is well, it's not the same, but there is that where
Yeah.
they could get not just monetary, but big vacations, that kind of thing, like
Hmm.
you're referring to. But
Yes.
that is separately, not as like the fraud part.
Yeah, exactly. So there's two parts to it, right? Which I'm not going to get into the other one because that's politics and bureaucracy, which kind of what you're referring to, right? Providers getting kickbacks to push a certain type of a medication to their patients. This one's technically the patient's not getting anything.
Hmm.
The provider is just charging for services, but they're not delivering it. They're just getting the money for it. And then a portion of those profits, they're giving back to the patient just to basically allow them to use their health insurance to charge those amounts.
Got it. Thank you for clarifying that,
Yeah,
Igor.
of course. All right. So what can someone do with your medical identity?
That's a loaded question.
Yes, it is. And we're not going to go through everything what they can do, but we're just going to cover a couple of main topics. So once they steal your information, they can impersonate you, obtain controlled prescribed substance on your behalf. This is probably the biggest one, the controlled, substances. The next thing they can do is bill for made-up medical services, right? This is more on the provider side. We have a screenshot here. This is an actual screenshot from a small hospital that was charging for treatments they weren't delivering, right? So kind of going back to the previous slide, this is in that same type of a boat where they're charging for something they don't deliver. And falsify medical insurance claims. Scammers can use identity to make false insurance claims for medical services and equipment reimbursements. There was a gentleman who billed insurance companies over $30 million in fraudulent medical treatments between 2014 and 2021, which added to over 100 million in healthcare fraud that he was able to successfully defraud insurance companies and government for it. So it's a huge business, and wherever there's a lot of money involved, most of the time there's a lot of people trying to get that. Alter medical records. This is a big one, especially if you were affected by medical fraud or theft, identity theft. Is God forbid you end up in a hospital, right? They're going to pull up your record, your medical history. They might see things on it that are not yours, which would prevent them from providing you with life-saving treatment or assistance to you. So which is very dangerous. And the other one, the last one, is obviously file for fraudulent financial claims as well on your behalf. And one of the significant challenges to public health care programs like Medicare and Medicaid is financial fraud. And typically, right, every year we see government lose about 60 to 90 billion dollars in fraud, right? I mean, that's a lot of money annually that gets lost because of that. Not only does the government lose money, they're also trying to make it up by charging us more for those losses. There was a very big nationwide brace scam for the knees. They ran advertising on TVs, on the radio stations. They had a call center set up. They had providers, doctors, and medical supply companies all kind of in on the same scam, where they would prescribe you medical knee braces, whether you needed them or not. to people, and the government obviously and the insurance companies would pay off. I'm not sure if you guys can see it, about $500 to $900 per brace that they would charge, and $300 would get, go back to the providers as kickback. So this was a very huge, I forget the amount, but it was in hundreds of millions that this scam, costed manufacturers, insurance companies, governments, and things like that. There's a phone number. We'll have a slide with contact information, what to do if you think you were involved in a fraud or you suspect a fraud, who to reach out to. It's very important to report those things as quickly as possible. How does medical identity theft affect you? Obviously, credit score, right? Credit score, you might get bills and charges that were not yours that you're trying to dispute. Unfortunately, a lot of times they would get placed as collections in your credit report, which then you have to go and deal with. That would lower your credit score, possibly increase your interest charges, things like that. So, pretty negative financial impact on that. Health misdiagnosis or mistreatment. With the example I gave, right? If you have something that was added by the fraudsters to your medical records, right, and you end up in the hospital, you might not get the necessary or the correct treatment because, again, of the false information in your medical history or report. And false incrimination, right? You could be charged with various different things, and then it's going to be on you to prove that it wasn't me. And unfortunately, that takes a lot of time and a lot of money to go through all that, even if you're absolutely innocent. So when we think of hackers and scammers, this is technically the image that people have, right? Somebody in a hoodie with a laptop, usually in their basement or their mother's basement, right? Something like this is the image we kind of have. But unfortunately, that's the image that was burned into us from the movies in the 90s and the 80s, which is completely inaccurate these days. When I say hacker or somebody says hacker or scammer, nowadays it's a business. Hacking is a business. It is a very big business. They've learned how to make billions of dollars a year, virtually impossible to get caught. And they're hiring, professional psychologists, psychiatrists, hackers, right? They hire these geniuses. I can tell you, we see ads on the dark web anywhere from $50,000 to $100,000 a month that they're paying, right? If you have the brain, you can make a lot of money very quickly. And again, chances are of you getting caught is very low these days, right? Because of the cryptocurrency that they usually request to be paid in. So what can you do, right? Safeguard your medical records, right? The big one is medical billing fraud is very successful because most patients don't review medical statements. Once you receive your statements, you just check okay, you look at if you owe anything or not, and you typically, throw it away or anything like that. Go through each one, right? Did you request the service? Have they double bill you? Are the dates and times of the service correct? Do the prescriptions, are these your prescriptions? Do they belong to you? Did they overbill you, right? Don't overshare your health information. This is something that I see it all the time. People post on social media all of their health information. They share that health information with everybody and anybody, right? I could be standing in line at a grocery store and all of a sudden the clerk asks somebody how their day is and they, give them the whole health history. I've had a lot of personal experiences where, I'm talking to a client or in a meeting, somehow the conversation switches to health and, they're sharing their entire health history with me as well. Don't do that. Because there could be a hacker or a scammer listening or trying to get that information from you, which, technically you're just giving it out.
I feel like I should just interject here, Igor, and say, I felt like this was a big thing when in the beginning of when people started getting their vaccines and their vaccine cards, right? And they started sharing that information on social media channels. And I mean, your whole information is right there and on
Yep.
everybody to see. And I was just so mind blown. Some people understood like they needed to cover up certain, aspects of their card, but I just was really blown away with how many people were actually doing that and not thinking it was a big deal. And it's a very big deal.
That's a great point. I completely forgot about those vaccine cards because not only were they sharing it, they were also giving it to others to use on their behalf.
Right.
Right. So I know, most of the agencies don't track those things, but at a point where it could be, potentially you are going to be in a lot of trouble for doing that. So yeah, thank you, Lauren. That's a great point. Ask why certain medical information is needed, right? This is typically if you go to a new doctor or you were referred to a different provider or something like that, and they say, okay, we need, all of these medical records, right? So as a bad example, let's say you go to a dentist, all of a sudden they want to see, your x-rays for your back, right? Which doesn't make sense. Why do you need to see that? So always ask, right? You want to provide as little information as possible to anybody who asks, just enough for them to do their job and not more and not less. Again, thoroughly review your medical statements. That's a big one because this is an easy way to catch something fishy that's going on, right? If you're not checking your statements, you're never going to be able to catch it. And over a period of time, it could be months, it could be years, you potentially could be liable for thousands or hundreds of thousands of dollars that are technically not yours, but then it's going to cost you a lot of time and money again to prove yourself that, hey, it wasn't me. So it's a lot easier to catch these things when they, in the beginning by taking your time in a couple of minutes just to review those, medical bills or statements that you get. Again, recognizing early signs of medical identity theft, that's very important. Beware for any emails asking you for medical data. Phishing and scam phone calls, right? A lot of phone calls come in, with about medical, either insurance, fraud, prescriptions, things like that. And again, fake Medicare and insurance phone calls, same as kind of the other one. My typical advice for you guys, if you get an incoming call, right, and they start asking you any kind of personal information, hang up. Call back the company yourself by looking at the phone number and a paper statement that you received the email or going to their official website. Call them back saying, hey, I just got a call back. Did you really call me? Do you need something from me? This is what I've been doing for the past probably 7 years, and I have avoided all sorts of scams by doing this. Monitor your credit report. This is a big one because you will see any potential collections or things like that. One of the things that the hackers and the scammers do once they get trying to commit medical fraud, right? They're going to try to change the address where those statements are going, not to tick you off. So the only way you're technically going to know something is going on if you look at your credit report, and you might see some kind of collections from medical billing agencies. This would be a good start and a giveaway saying something fishy is going on. You can also set up alerts for your credit report, so it's not something you have to log in and check regularly. If there's something new, some kind of a new activity, it'll send you an email or a text message. These are some of the phone numbers if you guys want to take a screenshot. If not, we'll also be sending an email out to all attendees with all this information. If you suspect, there's fraud going on, something doesn't sound right, it's better to be safe than sorry. Calling HHS, this number, 1-800-HHS-TIPS, and just talking to them, giving them as much information as they can for them to kind of look into it and see if there's fraud or not. What else can you do? So if you see something, say something. Question everything. The big thing that unfortunately I've had to deal with a lot is a lot of elderly people, disabled people. They are ashamed to admit or ask things, and unfortunately they get scammed, more than others. So don't be afraid to say something, right? If you get a phone call or somebody's asking you for money or threatening you or anything like that, hang up the phone, ask, talk to your family, talk to your friends, call the police department if you have to. but don't be embarrassed, because this is the biggest thing that I see is people say a lot of times, I was embarrassed to ask, my kids, or I was embarrassed to ask my friend or my colleague about it, right? It's a lot easier to be embarrassed for 5 seconds than dealing with financial and medical fraud for years, which is going to cost you a ton of money, frustrations, and a lot of time. Share your story. If unfortunately you were part of some kind of a fraud, tell others. Don't keep it quiet. Tell them how it happened. What you could have done differently. Share those things, share those opinions. This would help others. Moving on to our second topic of the day is exploding our COVID crisis, preying on emotions, curiosity, and urgency. So, and again, COVID's a little bit on the cooler side these days, but 6 months ago, a year ago, right? Everybody's on their phone, on their computers, TVs, nonstop COVID news, right? COVID counts of deaths, what's affected, who's wearing masks, who's not wearing masks, to get a vaccine, to not get a vaccine, all those pros and cons, and your mind is just blown, right? You're as confused as you could be. Other distractions, right? We started working from home, so kids, dogs, neighbors, deliveries, laundry, cleaning, things like that. So our days filled with distractions, frustrations, and stress, right? All of a sudden you get an email, right? And this email looks legit. It's from the Centers for Disease Control and Prevention, right? COVID's going on. I have to get this newest information, right? You click on the link only to be scammed, right? Same thing. You might get an email from your HR department, even a friend, even a provider sometimes, saying, hey, these are the new safety measures, or these are the new things you need to take, things like that. Again, they're trying to get you all off guard. Same thing, right? So all of these are called phishing, right? We get the point, right? Let's take a look at there's 3 different types of phishing, and why is it important to know. So first one is called spear phishing, right? Spear phishing is where someone impersonates someone you trust and gets you to click on the link. So you might get an email from a friend, you might get an email from your doctor, you might get an email from your boss or a coworker, somebody you trust, saying, hey, this is our new thing, or did you see the new COVID news? Boom, you click on it. The next one's called whaling. Whaling is typically or technically the same thing as a spear phishing, except whaling is targeted towards those who has the ability to send a lot of money. So in the business environment, there would be a controller, a CFO, maybe accounts payable person. In the typical household environment, could be the wife or the husband, potentially somebody that has access to a bank account, right, to make that payment. And then the last one is clone phishing, right? They're going to try to make an email look like it's coming from somebody you do business with. So it could be Amazon, it could be, a pharmacy, CVS, Walgreens, or a private pharmacy that you have your prescriptions from. Clicking on that obviously would take you to a page where they try to, have you fill out various information, your personal information, your passwords, your email address, things like that, which will be used to try to get access into your accounts. So all phishing has one thing in common. If anybody can guess, I'll give it a couple of seconds. If anybody wants to put anything into the chat, question, and I don't see anything, so we're just going to move on. So all phishing has great bait. Okay, that's the main thing in common. Something that gets you to take action, right? So the first thing, they make it emotional, right? This can be a fear of loss, anger, even curiosity. One of my favorite methods is curiosity. Oops, where you send this information, by mistake. All of a sudden you're curious. Okay, I want to open it. I want to see what was sent to me by mistake, right? The next one is urgency. they will try to make it urgent, and you have to immediately take action, right? Because the longer you sit and think, the less of a chance you're going to click on something or do something you shouldn't be doing. So they always include urgency into their bait. And obviously, fake, right? Counterfeit dollar bill works because people believe it is real. Same thing for phishing, right? They will try to make something look as real as possible, where in reality it's fake. And why do people fall for it, right? Because they are, they're busy, they're distracted, anxious, tired, right? Stressed, rushed. All of those things make us vulnerable for, clicking on something or doing something we should have not been doing, right? Plus, nervousness, right? Everybody's afraid of Corona or COVID, right? Everything that's going on. So typically, as humans, we're always looking for a fix or a way out. So we are afraid of, Corona and COVID and possibly, whatever else is going to come down the line. So anything that's urgent and emotional, right, and has to do with a hot topic in the news, people get, they want to know, and they will click on it, and they will fall for those scams and hacks. So what you can do, don't click on anything. If in this example, right, we can see that there's a link that looks like apple.com, but if you hover your mouse over it, you can see that it's actually going to be taking you to a different link, right? And this is exactly what's called phishing, right? So in a case where you do get an email with a link, right, like that, the best thing you can do is not to click on it, is actually open the web browser window and type in that address. That's the best thing you can do, and this will ensure that you're typing it in yourself and you're not clicking on something that's going to redirect to a different site and make you fill out some fake form. Slow down, right? Again, the hackers and the scammers, they're trying to make things urgent and emotional. They play on that, right? So slow down, take 5 seconds, take 5 minutes, ask somebody, right? Send it to your friend, a colleague, a family member saying, hey, I just got this email. Do you think this is legit or not, right? The other thing I want to mention about the email, you might get an email saying, your order has been canceled. Please call this number. Or we shipped your order of this brand new $15,000 TV. If this is not your order, please call this number to cancel, right? Again, those are all scams. If for example, you get an email from Amazon saying your order has been canceled, or you ordered this and it's been shipped out, go to Amazon.com directly, look at their phone number, or click on the chat icon and ask them, right? Do not call the number that's given to you. This is the big mistake that people make, is they call the number that the hackers and the scammers give, right? And obviously you're going to be talking to the scammers who are going to reassure you, oh no, you called the right company. This is all legit. Please give me your social security number and your credit card number. And question everything. Be suspicious of everything. You get an email, analyze it. Send it to somebody who can give you a second opinion whether this is legit or not. Even, last year we've seen a lot of, and they just started doing this, a year, 2 years ago, is they're actually printing and sending out physical letters, right? Because we assume that everything that comes in the mail is legitimate, right? And 99% of it is, but they've gotten so advanced that they're actually printing, letters that look like it's coming from your insurance companies, your credit card companies, IRS, and other government agencies. Again, you don't want to call the number that's given to you. You want to go to the official website and get the number from there and then give them a call. That would be your safest bet. And now let's go over and talk a couple of best practices for keeping your PHI. PHI stands for personal health information and other sensitive information secure. Every time I talk to people about that, this is basically the expression I get. I ask is, do you know what you need to do to keep your information secure? And obviously, we do not, right? This is not something that was taught to us, or trained. So I assume nobody knows what this is.
Looks
This,
like chicken scratch.
yes, this is a doctor's chicken scratch, believe it or not. So I was born in the Soviet Union. Back then, that was many years ago, and even till this day, they're still doing a lot of the things by pen and paper, right? So this is a page from a personal medical history book, right? So when I was born, my parents were given this book, this medical history book, which you have to keep yourself, right? You have to store it in your house. And then when you go to the clinic for a doctor visit or a procedure or anything, you need to bring it with you. You give it to the clinic or the doctor, they fill it out. It's basically your medical history that you're responsible for keeping and, providing it whenever you needed some kind of a medical treatment, right? Some of these books, I mean, they, were 4, 5, 6 inches thick, thousands of pages. As you can see, everything handwritten, glued, things like that. So we were forced to keep those. Luckily, in America, we don't have those, and most providers are using EHR or EMR, which is the electronic health or medical record system, right? So there's no need to have this type of information. And ultimately, my advice for everybody who's watching or listening is not to store any medical records on your computer, in your house, whether it's electronically or physically. The best way to have it is for your provider to store it in their system, and they store everything, your prescriptions, your appointments, your treatments, all your history, your blood work, and everything else. So whenever somebody needs that, you can simply log in and share that information with them or have the provider forward that information to them. But they definitely advise against keeping anything in your house, in your car, or in your computer. So this, hopefully we won't go back to these manual records. But this was a challenge, right, to do. So how do we keep those documents safe, right? So there's something that's called a document vault. Document vault comes with password managers. These are the top 3 password managers that we use and we recommend for our clients. 1Password, LastPass, and Keeper. 1Password is, in my opinion, the easiest to use. LastPass is kind of in between. Keeper would be the most difficult to use, but has the most security. But what all of these password managers have, they have again, a feature called Document Vault, where you can store all your documents. It stores them encrypted, so even if somebody gets a hold of your computer, hacks in, they won't be able to see those documents. Because what I see often, frequently, people scanning their bills, their tax returns, medical records, they're keeping everything in the desktop. It's so easy to hack a computer these days. Somebody gains access to your computers, well, they got everything. And they can do anything they want. They can open a loan under you, they can get a medical treatment, medical procedures, things like that. So you don't want to keep any documents on your computer directly. If you do have to keep documents, sign up for a service. Most of these have free plans or very inexpensive monthly plan where it's a couple of dollars a month. That will keep track of your documents. The other thing is the passwords, right? You want to make sure you don't reuse passwords. You want to have a dedicated, unique password for each online account to keep things separately. Because if somebody gets a hold of 1Password, they'll just be able to get into that one account and not all of your accounts. The easiest way and the best way to do that is with a password manager. With password manager, you just have to remember 1Password, and then the password manager keeps track of all the other passwords. You do not want to store your passwords in the web browser. It's not safe. Anybody who gains access to your computer can pull up a list of all your usernames and passwords that are saved in the web browser as well. So you want to avoid that as possible. And think of passwords are like underwear, right? Change them often, keep them private, never share them with anyone, right? And if you want to take it a step forward, further, keep separate underwear for each attire, right? Just like keeping the same password for each online access, unique, right? So I know this is a funny thing, but it's a good example of what to do and what not to do. Enable MFA and 2FA in all your accounts, right? Most of us by now know what this is. This is basically a second form of identification or authentication. When you log in into a website or your bank account, you'll put in your username, your password, then you'll either get a text message or a pop-up on your phone saying, you're logging in, yes, it's me logging in, or no, it's not me logging in. This single feature is probably gonna be the best thing you can do for your peace of mind and security.
I remember you drilling this into me, Igor, and saying, you need to use this.
Yes.
I do remember this.
Everyone needs to use it. It's free. It doesn't cost anything. Yes, it adds a little bit of a hassle where every time you log in, you have to look at your phone. But trust me, these couple of seconds of inconvenience is going to save you thousands and thousands of dollars and hundreds of hours of dealing with that. And I mean it, enabled on all your accounts, your social media accounts, your email, your financial accounts, your credit cards, banks, mortgage, student loans, anything and everything. Enable that. I have a list of a couple of don'ts, right? What you should not be doing. Posting everything on social media. I just don't get people. They, even some of my friends, right? Every 2 minutes they post something that on social media. Every step they take, every action they do in their day, they post it, right? Me as a hacker or a scammer looking at you, okay, I know you're not home, right? So I can break into your house easily, or your home computer, right? So you're just giving all this information, which is golden nuggets to all the hackers and scammers waiting for that, right? So if you want to post on social media, go ahead, just think before you post. And the other thing I recommend, make sure your social media accounts are locked down to where only your friends can see those things, right? And not just the entire public generation. Grocery store rewards. Every day, well, not every day I'm in a grocery store, but every time I'm in a grocery store, they say, oh, well, do you have the rewards with us? Yes. What's your phone number? And then you hear people, 10 cashier lines, everybody screaming out their phone numbers, right? And it just, it twists me inside and out. I'm like, you're just giving away your phone number out loud. If I'm targeting you, right? And I know we talked about a lot of these scammers and hackers following people online, but if you're somebody of wealth, right, they might target you offline where they're going to be literally following you in the stores, right? They're going to get your phone number, which is most likely going to be your cell phone number, which is most likely tied to your bank account and your other financial accounts. My next step is I'm going to call your phone company, pretend that it's you, to change phone devices, right? So now I get those SMS, I get those text messages, and then I'm logging into your bank accounts and transferring all the money. So never, again, this is what's considered oversharing, right? If I do have rewards in the grocery stores, I just tell them I'll type it in myself. You have a little keypad and you just type in those numbers yourself. Nobody has to see it or hear it. This is a big one. Don't leave your purses, wallets, documents, anything in the car. It's easily to break into the car. I know a lot of people leave their cars unlocked, right? I know I left the doctor's office once and I left my prescription in the car. I didn't think about it, but 30 seconds later, I ran back and I grabbed it because somebody could take my prescription or use it for other things because it does have other information on that prescription. Don't give your cell phone to anyone, not the number, your actual device. Because a lot of times people say, oh, can I borrow your phone? My car broke down or something like that. They can either install an app that will collect everything from your phone, transfer it to there, or potentially you might have a financial app like PayPal, Venmo, Cash Money, or there's a million different things where they can quickly, literally within a couple of seconds, transfer a lot of money from your account to theirs. So never hand anybody your phone that you don't know. Give any information on incoming calls. Like I said before, if somebody calls me, they're saying, oh, we're calling you from a bank, we need to verify something, blah, blah, blah. I hang up the phone, I call my bank, say, I just got a call from you guys. Was it you or wasn't? Do the same thing for anybody that calls and asks questions that they shouldn't be asking. Don't click on any links and emails. Again, type it in into the web browser, look at the address, type it in, or go to the website directly. Don't keep any sensitive documents on your computer or cell phone. A lot of people like to keep their passwords on a notepad on their cell phone, which is very insecure. A lot of people keep it in calendar, things like that. Again, phone is the same thing as a tiny computer. They could be hacked. They are getting hacked. So don't store anything sensitive on it, especially no sensitive pictures, because those get leaked all the time, as we see with a good example with politicians. And the big one, do not use the same password for all your accounts. You want to have a dedicated password for each account. This is how a lot of people get hacked. They get all their savings stolen, everything, because they use the same password. Invest into a password manager. They're super inexpensive. They have the free one. They have the free plans. They have, the ones that cost a couple of dollars a month. It's going to save your life. Do's. All right. Question everything. Again, if something is fishy, if you're unsure, don't feel pressured. Slow down. Question it. Forward it. Ask. Wait before you do anything. Enable MFA, 2FA, and all your accounts. Again, that's that second authentication step when you're logging in. Unique password for each account. This is a must. No exceptions on that. Check your financial accounts regularly. A lot of times we don't log into our banks or credit card accounts. Don't do it daily, but once a week, once every 2 weeks, log in, make sure everything is there and there's no transactions that you did not authorize or you weren't aware of. Separate checking account if using checks. So I see a lot of people still using checks these days, which is normal. I also, write checks, personal and for my personal and business things. The mistake that people make is they have one account in the bank, and this is where they're writing their checks from. So all your savings in this one bank account with a checkbook. You give me a check. On that check at the bottom, I have your account number, I have your routing number, and the top I have your name, I have your address, and at the bottom right corner I have your signature. I'm not sure if you know this or not, I can order blank checks and print all that information out. They can print your account, your routing number, your name, and everything else. Or I can order your checks. Any online check printing company, I go in, I fill in your information, I get actual bank checks from your bank account, and I also have a copy of your signature. Right? So for me to make a fraudulent check is super easy. And it's not only for me, it's for everybody. You want to have at least 2 bank accounts. You want to have your main bank account where you keep most of your money, and then you have your checking account from the account that you write out checks that you keep only the amount for the checks that you write. So if somebody does do this where they clone your checks, they won't be able to steal all your money. You're gonna get overdrawn. The check's gonna bounce. Obviously, you're gonna have to explain to the bank. They'll revert the fees, but this will help preventing hackers and scammers from stealing all your money. And unfortunately, this happens very frequently because it's so easy to do. Use credit cards instead of debit cards. Credit cards have a higher protection than debit cards. If there's unauthorized purchases, if you at a gas station, I know a lot of restaurants these days, still unfortunately some people are in bad financial situations. You give a waiter or a waitress a credit card in the restaurant, they'll swipe it or they'll take a picture of it and then they'll try to use it, for some kind of online shopping later on. Then again, it's up to you to prove, hey, this was not me, right? Sometimes it takes a lot of time and resources and things like that. So with credit cards, it's a lot easier to reverse those unauthorized transactions than debit cards, because debit cards are linked to your bank account. It pulls the money from your bank account, and it doesn't have the same protection as the credit card. Don't throw away bill statements and other sensitive documents. Make sure they are shredded. I know a lot of times, if you're leaving the doctor's office, they give you, a billing statement or any kind of things like that. Again, those are all available digitally from your doctor's account through their portal. So I just hand it back to them and say, please shred it. Don't give it to me because I'll leave it in the car like I did, or I'll bring it to my house and then it might get lost or stolen, right? So if you don't need it, don't take it. And if you do take it, make sure you either secure it properly or you shred it. And if it's too good to be true, it probably is, right? If you get an email saying, you won $1 million or something like that, you probably didn't, right? Again, question everything, slow down, don't click on anything, don't take any fast actions. I promise you, there's nothing in your email that you're going to get that you need to click on something within 10 seconds. And a little humor, right? I know this was a little, on the negative side, so we want to cheer everybody up a little bit. So question, how does a computer get drunk?
How?
All right, well, it's super easy. They take screenshots.
Oh, I like it.
Yeah, that's an old one I've been using for a while. And obviously one of my other favorites is about tracking cookies, right? They'll never get my recipe.
Oh, great.
Yeah, so that brings us to an end, and I think we might have a couple of minutes for questions and answers. If anybody has anything, I'll be more than happy to answer. And again, I just want to mention we'll send an email out to all attendees with more information, contact numbers, and probably a little PDF of do's and don'ts.
So we only have a couple of minutes, but there were a couple of things that I wanted to comment on, Igor, for our listeners that may not know this. And you were really harping on, you need to be very careful. Everybody needs to be very careful about giving people just anything about them, their information. And this happened to me a long time ago, probably like four or 5 years ago. I went to an urgent care, and I don't remember, I was getting stitches or something, and I'm filling out the forms, right? This was out of state, I'd never been there before, and they asked for my social security card. Well, that kind of raised a flag, because I just want to tell our listeners, you do not have to give them your social security number. You don't have to. This is not a place that you're going to be continuing to get treatment, that they're familiar with you. A lot of times I have asked in the past, why do you need my social security number? Or, I will give them the last 4 digits, but they don't have, you don't have to give that to them, or just ask questions around it, like you said. And then the other thing I really wanted to comment on was the fraudulent billing. There's a lot of things, unfortunately, that have happened to me that you went over today that I'm very aware of, and I go over and I do. But this is one of the things that I do. I do get a bill from the provider, whatever it was, the service, the medication, the device, whatever it is. And then I go online and I compare that bill to my insurance EOBs. Either I do it through my portal, with my insurance portal, or the actual physical copies that come in the mail. And I make sure there's nothing on there that's super fishy. I know that's kind of above and beyond maybe the average person would do or patient would do, but again, I've had a lot of things that have happened with me and my medical record and PHI. So I did want to ask Igor a question. How does one file for identity health fraud? How does somebody go about doing that? And I know there's not really an easy way or solution, I guess.
It's a difficult question to answer, as it would depend on the type of medical fraud or identity fraud that occurred. As you know, as I mentioned, there's a couple of different ones. The best way, unfortunately, I personally haven't dealt with a medical fraud, but probably the best advice I can give is, let's say if it's medical fraud, that has to do with your insurance, right? It could be insurance claims or something like that. I would reach out to the insurance companies and ask them, right? These are not my claims. I don't know where they came from. What do you recommend? How do we go about fixing it? That's probably going to be the best answer I can give. Contacting HHS is another one. They would actually file an investigation and look into it, right, to see what happened, what's going on, because probably you're not the only one that were defrauded in those things. Also, obviously, talking to an attorney, they would point you into the right direction as well. I just don't have enough, I guess, knowledge in medical fraud with the actions to take. But the first one, obviously, going if it's a claim fraud, right? Reaching out to your insurance or Medicare saying, these are not mine. What are my next steps? And they would probably tell you, well, we have a department that deals with these. You have to submit your, certain amount of paperwork. Then they, would investigate and make a determination, well, whether yes, these are fraudulent. We're going to remove all of that from your account. Or they might say, it looks like these are yours. This is where you have to get an attorney to assist you with those things. Or they might say, we need more time to look into it because you might be a part of a bigger case with those things.
Thank you for that, Igor. And one other question, I know we're out of time, but I thought this was kind of an important one too. What are the ways that HHS is helping to protect patients? PHI and other government agencies are helping to protect the general public with these healthcare scams.
Yeah, excellent question. So what HHS is doing is they HIPAA, right? They have a framework that any entity that stores or come across PHI, your personal health information, that there's certain rules that they have to abide by, right? Both on the technology side, they have to make sure that your information is secured and protected, encrypted. More importantly, also on the human side, what do you do, right? Because a lot of times in bigger medical practices and hospitals, things like that, you'll have a janitor, right, that comes across somebody's medical record. What do they do? Do they dispose? Do they give it? Plus now they've seen it, things like that, right? There were recently, a couple of years ago, there were a bunch of cases on the news where nurses released confidential information about their patients who were celebrities, which is a breach of of HIPAA and PHI. So HHS, basically what they're doing is they have a framework that all entities, and it's not only medical doctors, right, that have to abide by those rules. It's the billing companies, it's the attorneys that deal with any kind of medical records, right, your personal law, personal injury law attorneys, things like that. They have to abide by those things. Unfortunately, a lot of them, especially the smaller organizations, they do not, because it's very expensive. It comes down to money. It's very expensive
And
to
time consuming just for staff wise.
Yeah, to apply all the requirements that HHS has set out. So speaking from experience, and again, unfortunately, most of the smaller providers, billing companies, attorneys, and other entities that deal with PHI don't follow those rules, and they do get breached, and then your information gets leaked. So they don't take it seriously for one way or another. We have a lot of medical clients, and we work with the only ones who do take HIPAA seriously, and we help them to get compliant with HIPAA, making sure all the safeguards are in place and things like that. So HHS is trying. Unfortunately, again, a lot of the smaller practices and providers and entities, they are not doing it to the point where they need to protect their clients' data.
Well, thank you, Igor, for being with us this afternoon and volunteering your time to educate our community. And thanks for our audience for tuning in to this presentation. Also, if you enjoyed today's presentation, please consider making a tax-deductible donation to AIDA on our website at www.godoaida.org. Your contribution will help us to be able to conduct educational initiatives and webinars such as today's, and also be a resource for our patients and medical community that we serve. This is Lauren Dunlap for Advocacy and Awareness for Immune Disorders Association, or AIDA, and we hope that you have a fantastic rest of the day. Thanks so much. Have a good day.
Thank you, everyone. Thank you, Lauren.
Bye.